Hi, I'm Larry Downs, Chief Executive Officer of the Medical Society of New Jersey, and I'm here with Amanda Shiber, our Chief of Staff. And today we're going to discuss the patient arbitration process under the New Jersey Out of Network Consumer Protection, Transparency, Cost Containment, and Accountability Act. Um, there is a provision in the out of network law that gives patients the ability to dispute charges that they receive for care. And we're going to go through a few slides here. Actually, one slide with some steps that can educate you on what patients' rights are under the new. So, what's the claims process for a patient that's insured by a self-insured plan that did not opt in to the out-of-network law? So this is for ERISA governed plans that have not elected to opt in and be subject to the jurisdiction of the law. What are the rights for patients in that situation? And our new law gives us several. So, Amanda, why don't we start with the first part of the law about the knowingly, voluntarily, and specifically choosing an out-of-network provider.
Okay, so first off, the physician may bill the payer or the patient for the services when they're in a self-insured plan that did not opt into that law. So with patients, if a patient knowingly, voluntarily, or specifically selects an out-of-network provider for services, that falls outside of the law. Then just the disclosure portions apply. And knowingly and voluntarily, if you listen to our disclosure presentations, you'll understand how you get to that through notifying the patient and then also having them acknowledge that they're receiving the services.
So I want to underscore that point. In commercial plans under this law, the physician may not bill the patient, can only work with the payer. For a self-insured plan that's not opted in, all the rules that previously applied still apply, and you can bill the payer or the patient for the services. However, the patients are going to have some rights to challenge your billing. So the first step in this process is determining the patient voluntarily select you for services. If the answer to that is yes, as we've discussed, only the disclosure portions of the law apply, and we have a separate presentation on just simply the disclosure obligations for physicians. However, if the physician and if the patient did not knowingly, voluntarily, and specifically select the out-of-network doctor for this medical services, the next question we need to get to is, did the physician and patient agree on a payment amount within 30 days of the patient receiving a bill?
Right. So when the patient does not knowingly or voluntarily select an out-of-network provider, we're really talking about emergent or inadvertent care. And that's really what the out-of-network law is trying to wrap its arms around.
So this is a patient that you might get in an emergency room or on call,
Right.
or see in a hospital that didn't have the ability to select you as a physician.
Right.
So if you did agree, and we answer that question in the affirmative, it's pretty simple.
Right. So the physician sees the patient in an emergency or an inadvertent situation. They have a self-insured plan that did not opt into the out-of-network law. The physician sends a bill to the patient, and the patient has 30 days. They say they got their bill, they pay it, they've all agreed, over and done with.
So if the answer to that question is no, there is no agreement. Now we have a dispute about
Yes.
payment, and the physician or the patient can initiate arbitration to be paid more or to challenge the amount the physician has.
Right. So if the patient receives a bill and wants to challenge that bill or doesn't want to pay the full amount of the bill, they have 30 days after receipt of that bill to file for arbitration. The same goes for the physician. If they bill a patient and the patient does not pay them in that 30-day time period, they can also file for arbitration.
And who are we arbitrating with when we do that?
You mean who is the company? Well, right now the state's using Maximus, who runs their other program under PICPA. So Maximus is the arbitrator at this point. It's important to note that once they go into the arbitration process, the physician can't continue to balance bill the patient or continue any collection proceedings, because now it's up to the arbitrator to decide what's going on.
Yes, once you've chosen arbitration to resolve your dispute, all the other collection efforts must cease. So the next step in this process is to differentiate between physician-initiated arbitration and patient-initiated arbitration. Let's take physician-initiated arbitration first. What do they have to do?
The physician has to file a request for arbitration with Maximus, the vendor for the state of New Jersey, 30 days after sending the patient a bill for services.
So you send a bill, you don't get paid for 30 days, your option at that point becomes ripe to submit your dispute to arbitration. And for patients, almost a similar reciprocal process where the patient files a request 30 days after being sent the bill. So they have 30 days to decide whether to pay the bill or to challenge the bill.
Yes.
So what happens once the arbitration is filed? So obviously there are notifications that the patient or the physician has initiated this process. The vendor is going to review the document submissions from both parties. And then the arbitrator, based on the information submitted by the parties, will issue a decision. What other things do we need to know about this process for physicians and or patients?
So the arbitrator provides their written decision in the end, like you said. That will include a final binding payment amount that the arbitrator deems reasonable within 30 days after that request arbitration is filed. So the arbitrator has 30 days to make its decision. Now, they can include a non-binding recommendation to the self-funded plan for its contribution to payment for the service, but that's, again, non-binding. So the plan may decide to put in more money, or they may not.
So the plan at that point can either follow the recommendation of the arbitrator that, hey, plan, you should have paid a little bit more money, but at that point it's completely voluntary on behalf of the ERISA plan, either abandon the patient and leave them with the entire due amount, or whether they should pay a little bit more and split that amount with the patient in a higher cost sharing.
Because they've decided not to opt into the law, there's nothing to hold them to it. Then the arbitrator's expenses are split between the parties unless it's a hardship for the patient, and then the arbitrator may waive the patient's portion of the fee.
What kind of information can physicians bring into this arbitration process with the patient?
Well, they should bring in examples of their fee schedule and of how that compares with the market, really. So, like the Fair Health Database is a good example, or examples of payments that they receive from other payers.
For similar services. The bottom line is that there is no limit in terms of the kinds of information that physicians can bring in to an arbitration. Likewise, there's no limit on the information patients can bring in, so they can bring in information that they can get from other sources about what common payments are for this kind of procedure that's under dispute.
Well, I even think the medical record and showing the complexity of a case, if it's a really complex case, can be helpful too in this situation. And Maximus may even ask for that information.
So that's the summary on the patient arbitration process. I want to thank you for joining us today. And don't forget to download our guidance available at www.msnj.org/OON. For more information, please feel free to contact our member resource center at 609-896-1766 extension 0, or email us at info@msnj.org with any questions on this presentation.